Look at another kidney issue, and this is what is known as a proteinuric renal disease. Proteinuric renal disease. So it just simply has to do with you have a kidney disease and it's causing proteins to leak out. So normally proteins should not leak out; it should be maintained in the body. But these proteins are leaking out. That's when you're saying you have proteinuric kidney disease. You know, so just refer to kidney condition, and in this condition, proteins are leaking out in urine. Okay, and usually signals that the glomeruli are getting damaged. This glomeruli, that blood should come here, and normally the protein should go back into the body. But for this, it's leaking out. Okay, so persistent proteinuria is okay. That's just by the way. Okay, so just so you know, normal urine protein should be about less than 150 milligrams per day. Some proteins will escape. Okay, so but once it is more than that, you have a proteinuric kidney disease. Okay, and it could be so much. That's when you now see there's what nephrotic syndrome. So proteinuria indicates that the glomerular filtration barrier or tubular reabsorption system is damaged. So causes of proteinuric renal disease include all those glomerulonephritis, diabetic nephropathy, hypertensive nephrosclerosis, focal segmental glomerulosclerosis, hemoglobin A nephropathy, systemic diseases that affect the kidneys like what lupus nephritis, amyloidosis, multiple myeloma. Okay, secondary causes could be due that you have hypertension that has been there for a very long time, or preeclampsia in pregnancy, or you are taking drugs that are so toxic and they're actually affecting the kidneys. Okay, so pathophysiology, there's damage to the glomeruli. So because there's damage to the glomeruli, proteins they leak out, especially albumin. So tubular, um, that's proximal tubules. They try to absorb the protein back, but they are not able. So they overwork, and this will cause inflammation, oxidative stress, and fibrosis. So proteinuria will further worsen the kidney damage. Okay. So symptoms is you have foamy or bubbly urine, edema where there's swellings in the face and the ankles and the abdomen. You are weak, there's lots of appetite, muscle cramps. You know. So in nephrotic syndrome, the swelling is so severe, and you are losing a lot of protein, so albumin levels are very low. So you diagnose is using the urine dipstick, 24-hour urine collection, blood test. You image to now look at if there's any anatomical damage to the kidneys. Okay. So treatment is you address the underlying cause. Okay. Diabetes, hypertension, autoimmune disease. Then also renal protective disease like angiotensin converting enzyme inhibitors, angiotensin receptor blockers, and also the SGLT2 inhibitors like the dapagliflozin, empagliflozin, and also the finerenone. Okay. So lifestyle changes like the amount of salt you are taking should be reduced. Blood pressure too should be controlled. If you smoke, you have to stop smoking. And also weight management. Okay. So this is what we have for proteinuric renal disease.